Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapist. I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Nils is looking at me funny. Did I say something weird?
No.
Did I?
I was wondering because you kind of took a stutter there, so I didn't know if you thought you said,
No.
you said something.
I was just trying to pause because I feel like I run through it so fast sometimes that it like all blurs together. So I'm like, I can pause.
It just means you're good at this.
Yeah. So I was like, but I got to look from Nils. When your producer gives you the look, you and you're me, and you've said things like
everything.
Listeners from questions.
Listeners from questions.
Yes. Listeners from questions. If you want to know what that's from, you should follow us on YouTube and watch our top 5 of the year.
Why don't you start again? This is started over.
No, I don't. We're rolling with it.
Okay,
No,
I got you.
I like this.
You usually say practitioner, but you say nutritional therapist.
Oh.
So
Okay.
you just left a word out.
I did. I'm a nutritional
Threw me
therapist.
off.
I'm a nutritional therapy practitioner.
There you go.
Yep. And I'm joined today, as always, by Dr. Jason Martin,
And I'm a board certified plastic surgeon.
plastic and reconstructive surgeon. What is
Reconstructive.
it with us dropping words today?
I know.
Yes.
Bring them in.
Dr. Martin, we have a great episode today. If anyone is listening to this and you've made it this far, thank you. It gets better from here. You can also watch us on YouTube. You can find all of our social media handles linked below. We're everywhere at Jason Martin MD and at Beauty and the Surgeon podcast. Dr. Martin, who was the singer in the 80s who had that song, Let's Hear It for the Boy?
That was from Footloose.
Footloose soundtrack.
Oh, jeez.
We can't play the song, but Nils, could you insert a clip of the video from it? Because we'll get copyrighted for the song. But that's kind of what I was thinking about, like, let's hear it for the boys. Because this episode is all about plastic surgery myths for men.
Nice.
CeCe Williams? Williams.
If that's even close to the name, you were a savant.
Something Williams.
Yeah.
CeCe, CD.
Close. Denise Williams.
Denise
Denise
Williams.
Williams.
Denise Williams.
Very
Yeah.
good.
Denise. Okay. But spelled weird, right? Like there's C's in it. Denise with a C.
Yes, DNIECE.
There we go. Okay.
Yeah.
Denise Williams. Let's hear it for the boys.
Yeah.
So this whole, we're going to have a series. So there's going to be 3 episodes in a row that are all about surgery for men.
I do think Footloose is really analogous to what we're about to talk about, because here was Kevin Bacon in a small town that was very conservative, did not believe in self-expression and dancing.
Mm-hmm.
Men sometimes feel that way.
They don't believe in dancing.
Self-expression, being the person that they are. They may not think that they should do certain things like plastic surgery. It's very analogous.
Yeah. So we're starting off this series with plastic surgery myths for men. And there are a bunch. So I just picked 10 that are kind of like the ones that we hear the most and that I also hear from other people the
Right.
most. Like specifically from women even, talking about plastic surgery myths for men. So without further ado, Dr. Martin, let's jump in.
Let's go.
So number 10, plastic surgery is only for women.
That's absolutely not true. It's not true in our practice, and it's not true in most cosmetic surgery practices. Now, if you look at the percentages, we look at all the numbers every year with different, procedures and stuff. Most of the procedures, it's a high majority women doing it. Some cases 80%, even 90%. But
Unless it's
gynecomastia, number 1. Obviously, that's more of a male-oriented procedure. 80% of all men in their lifetime have gynecomastia at some point. Now, most of that resolves for people as they get to that early 20 stage. But gynecomastia is very common. Rhinoplasty, done a lot of those. And why have we done the rhinoplasties, at least in the state of Colorado, Amy?
usually from injuries.
Yeah, because they're numbskulls. Like I remember the one that we did. He was a rugby player, and I said, "How did you fracture your nose?" He goes, "Which time?" Eyelid procedures, 100%. Men, everyone has seen a man in my age group, a little bit older, with heavy eyelids. So there's a functional part of that and an aesthetic part. Liposuction, huge for men. I would say our percentages in our practice for liposuction are probably 60-40. Like that's okay.
I'd go 70-30.
Okay, I'm just giving. Let's hear it for the boys.
Yeah.
And then neck lift is very common. And one of the more common ones we do is direct excision neck lift, but just any kind of facial procedure for that matter.
Yeah. So it is absolutely not just for women, but that's how this whole thing started. I told Nils this before we started that just last week, I was taking out sutures on a woman from a facelift, and we brought up something about men, and she's like, it's just so sad that men don't have these options. I'm like, yes, they do. They have many options. And
Right.
Yeah, they do.
Well, the weird thing is when you see a man who feels that way, and I've had patients even come in like that.
Yeah.
And they really believe that in their heads. And I'm like, well, you do realize you're in a plastic surgeon's office. And I think that they can't do some of these things. They're going to look weird.
Well, don't jump on my myths, Dr. Martin.
Okay.
Let's look at number 9.
Wait, aren't you gonna bust it?
Oh,
It's been so long.
it's been so long.
It's like, come on.
I know. I'm grabbing Amy's arm right now.
Words today.
Amy, I think that myth was busted.
All right. Myth number 9. The results will look obvious or fake.
Yeah.
And there is absolutely, it happens with women as well, but more so with men. The bad gets a lot of buzz.
Oh, and there's definitely bad out there. And there's bad historically.
Mm-hmm.
I don't want to talk about certain people that aren't with us anymore in this earth, but there are like musicians and famous actors who historically have looked really weird or
fake. Yeah.
Or different or not like themselves. So you can understand why people have that feeling.
Yes.
But Amy can say it better than I can, but our results, at least in our office and the people that I respect, they're subtle, nice, masculine, affirmative, and they solve the problem that you have. If you have hanging skin on your neck because you lost 50 pounds, a neck lift will solve that problem and you still look like yourself.
Yeah. And, it's the same thing goes for women that goes for men. When you see results that look obvious or fake, that didn't happen from one surgery in most cases. And there's definitely something deeper going on for that person that is causing them to continue to seek correction for something that maybe doesn't need to be corrected.
Right. And we've talked about this before on the rhinoplasty episode for men. That's a high risk category of patients for body dysmorphia. Body dysmorphia, I don't know what the percentage distribution on male and female, but it's definitely prevalent in men too.
Mm-hmm. And becoming more prevalent. I think with social media, it's definitely something that's affecting the younger generation of men more.
Right. I wish I knew all the words, but there was something recently where they were kind of young men really augmenting themselves to make themselves look more masculine. There's a name for it. And it's just really disturbing to see some of the things that are going on in the like 20 to 30-year-old range. Mm-hmm. With that said, the results we're talking about that quote unquote look weird usually have like a facial connotation. Mm-hmm. But we've all seen in like modern media results that look weird for body stuff.
Yeah. Calf
implants, over sculpted liposuction on the abdomen.
Weird high def.
Yeah.
Mm-hmm.
And clearly with any kind of procedure, there's always risk. That's what this podcast is about, talking about the risk and what's associated with procedure. People can have bad outcomes, but in general, men are great candidates for a lot of these procedures. And it's really kind of devastating as a man who's also aging, with working with someone who doesn't age. Her name is Amy. Mm-hmm. To have men come in and I can relate to them and they're like, well, I can't do anything about this, or why would I do that? I don't want to look different. I'm like, well, you can look better. And that's really empowering. So this fake look is not a reality for what we do in our practice and practices like mine.
Yeah. So what is this myth, Dr. Martin?
This myth, Amy, I think it's busted.
Busted. All right.
I wish I had the edit in my ear because I watch it. I watch this episode just for the busted part. Yeah.
Maybe we upgrade to a sound effect panel. I'm going to need one more, I think. So.
Where I press it myself. That's a bad idea.
Yeah, no. Nils would have control of the sound effects.
I will keep control.
You would have a switch that turns it off when you don't want it on? Yeah.
So myth number 8 is that plastic surgery is vain. And, that is something that affects any gender. That's something that people, and a lot of our other myths will kind of piggyback on this one. Because people do feel like guilt spending money on themselves, spending time on themselves. They think they should just get over it. They should just deal with it. Those are all things that people say to us. And, so I understand why people feel that way, but it really isn't. You get one life and you get one face in most cases. And, I always say that to people like.
And one chest and one abdomen.
Why spend any time disliking this if there's an option to fix it? That's not vain.
No.
And really, it's less vain than people think because no one else really cares except you.
Right.
So do the things that are going to make you happy.
Yeah, I just talking about men is just such a conundrum because we've talked about many times before the unreal expectations of our society and culture on women. Well, men is kind of the inverse of that. At least as a heterosexual male, I can say that people don't really care ultimately kind of how you look. It's less emphasized for good or for bad. Your demeanor, your height, blah, 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 all these other kind of things that are probably more emphasized. But behind that whole facade are actual people, men, who have feelings and emotions and self-perception, and they have a difficult time expressing it because the emotional intelligence of men in general tends to be pretty poor. And then they feel stuck and they feel like they can't do anything about it. What has really brought this out of the cupboard behind the closed doors is this weight loss era that we're in with the GLP-1s. You're seeing so many men with such notable weight loss, and the only answer for a lot of that presentation, if you lose 100 pounds or 80 pounds or 70 pounds, is surgery, period. So it's on top of this feeling that they're being vain, they have this problem that the only answer is surgery, and they're feeling bad about even considering it. Cost of surgery is a limitation for a lot of people. Mm-hmm. And that's also frustrating, but I understand that. That's budgetary. But just having this feeling that, man, I shouldn't do this. I'm like overreaching. I wish that we had better words to explain to people it's not that way. We don't, if you can believe this, I know this sounds like a homer speaking about what we do, but I don't feel like we have a lot of vain people that come in our office, and we have a successful cosmetic surgery practice. The people that come in, at least when I talk to them, sound totally rational. Their complaints are totally down to earth and realistic, and their expectations are realistic too. And not one of them is saying, I can't wait to walk outside and show everyone. They just want to, they all say, I just want to feel a little bit better for myself. So that's not vanity. It's the opposite of vanity.
Exactly. I agree with that. So what is this myth?
This myth is busted.
Took me a second to find it, but was the term you're looking for looks maxing?
Looks maxing.
One word. Yeah. It's primary overreaching term for men using surgery and cosmetic treatments to shape their face.
Yeah.
So I'd never heard that.
Yeah, so looks maxing, there's like famous people on the internet, like the whole TikTok generation, where they do at least pretty extreme things to look even better. Not just Botox, but they'll do implants and fillers and all this kind of stuff. So
well, but what we call extreme, again, like,
Are you calling me old, Amy?
No, I'm not. I'm just saying, like, finding a solution to a problem that you perceive.
Right.
Who are we to say that that's extreme?
That's a good point. I mean, you're really actually saying the truth. Mm-hmm. And to each their own, in the eye of the beholder kind of situation.
Like, we don't say that same thing about feminization procedures.
Right. That's true. So, yeah, I think you could make a really good argument for that. I think the thing I struggle with, which is only from my perception, and again, I'm not the overseer of all these things and the ultimate answer, but a lot of these people look really good to begin with. So you're getting into the weeds of trying to make something 2 or 3% better. If you're a 25-year-old,
again,
I know. I go to the gym every day to get 1%, like 0.1%.
There are
better.
women with perfectly beautiful breasts who want them to be bigger, but there's literally nothing wrong with them the way they are.
Right. And maybe it is a double standard. Maybe that's what you're pointing out.
Yeah.
Maybe I too have been, shaped by society's viewpoints on men. Men shouldn't do these things. Men are this, men are that. It's not.
Or that this is extreme for a man to do.
Yeah, you're right. Yeah.
So
maybe, is this a myth?
Maybe, it's not, but yeah.
Sorry, kind of sorry.
Oh, okay.
That's
Okay.
All right.
I feel like I should go to therapy.
Okay. Let's talk about myth number 7. And that is that only older men get plastic surgery. So it's for old guys only. And this is so not true.
Not true at all.
No, in fact, I would say that there's more men with women, it's very much a mid-range, right? So I think the most are going to be between like 30 and up. Whereas with men, I feel like it's actually more weighted on either end of the spectrum.
Right. And a lot of that is their presentation for what we treat. The young men, it's going to be gynecomastia, liposuction, and post-weight loss things.
Rhinoplasties. Otoplasty, that's another one that's big.
Oh, otoplasty. We forgot about that. I mean, that's very neutral on sex. But otoplasty, which we have a great episode on that.
It's old. Don't judge us.
Actually, no. Just show the video I have on that. It's on my YouTube channel.
That one's better.
That one's way better.
It's an old video.
You don't want to see me with a sport coat looking like 6 years old. But yeah, you could, and like you say in here, jaw contouring, and it could, by the way,
looks maxing is what that we now know that is.
A lot of those people, and this is, you see this a lot in men, they'll have occlusion issues. Their teeth don't fit together well. So they'll do the jaw surgery to have better occlusion. They need to for functionality. And at the same time, a lot of those men have retrusive chins or not developed chins. They'll do a genioplasty or a chin implant or move the bone around so their chin's more prominent.
Well, I would even have face tight in that same category with jaw contouring. We
Yep.
did it on a young man recently, and
Yep.
he had thought he would need some, he had initially asked about some jaw filler after this procedure. And I said, let's just give it a few weeks.
Yeah.
I don't think you're going to need and or want it. And sure enough, the face tight was enough to like give that definition to the jaw that he thought only filler could give him.
Yeah. And speaking of the looks maxing, he was someone who was very attractive, handsome to begin with. And he looks even better now. So we basically looks maxed him because he was in his 30s. Yeah, that's a really good point.
With an easy face tight procedure to contour his jaw a little.
So women tend to follow, and there's different categories of people, so I don't want to start being dogmatic here or tropey, but like women tend to fall in that post-pregnancy era where they'll do body work and breast work and things like that. Where you see with men will come in starting in their 30s and 40s now for the Botox and the eyelids. Mm-hmm. The eyelids tend to be a problem for men in their 40s. You'll see that. It's a lot more common these days. I think men are more empowered to do eyelids, which they should be. And then just like women in the 50s and 60s, 70s, face and neck procedures are king. And those are the ones that they come in searching for.
Yeah.
So they, for whatever reason, for probably all the reasons we talked about, they don't tend to know what they're looking for when they come in. Women tend to be a lot more educated, but they just don't like the things they see on their face and neck.
Yeah. And our next 2 episodes are going to cover face and neck lifts for men in detail.
Look at that.
Yeah. So there's going
Dovetail.
to...
It's like the men quarter. I like this. We're really pro men.
Yes. All right, Dr. Martin, let's bust this myth.
Oh, busted.
All right, number 6. This is one that a lot of people think, that recovery will be long and painful, meaning they'd have to take tons of time off work or hide out completely, and that it's painful. Okay, some of these things we do are painful. Lipo, it's definitely painful.
Yep.
Recovery from most of the things we do is relatively short, all things considered.
Yep.
I mean, you think about recovery from surgeries, and this is true of most, at least in our area, most men who've had surgery before, they've had like an ACL or a shoulder and
or
like
a knee replacement.
Yeah, and it's been like months of recovery and rehab and PT, and they had to take 6 weeks off work, so that I get why that's in their head. Because then they think like, oh, well, if, that was that bad, like how bad would plastic surgery be?
Right.
Like, oh, it must be so much worse. But in reality, it really isn't. Most of the procedures we do, you could be back to work, depending on what you do for work, within a few days. You're working from home. Yeah. In most cases, and back to forward-facing work, even from like a pretty involved facial procedure within a month.
Even sometimes a couple weeks.
Yeah.
Yeah. For face and neck lifts, men don't really have the luxury usually of longer hair, so it's harder to hide things as women can. Men don't usually wear makeup. Some do, but most don't. So it's harder to...
They do wear sunglasses, though.
Sunglasses are good.
We've had a few professional men who've had their eyelids done, and there is some bruising with that, and they've just worn sunglasses.
So body work, you could be front-facing pretty quickly, even
right
with
away.
a tummy tuck or something like that. Mobility can be a problem. A lot of men cherish their mobility and being able to do things in whatever sport you like.
That's all people.
Yeah. So that can always be a little bit of a hindrance, mentally speaking, in recovery. But I can't even think of many surgeries that are so painful that you would be scarred for a long time mentally from what we do. There are some of the bigger body things we do can be really hard to recover from, but most of the smaller procedures we do, it's a blip and you're ready to go.
I think the only challenge with men having surgery is that they are never fully prepared for how intense a tummy tuck is going to be.
Yeah.
And that's just, because women tend to have more things that affect their abdomen in general over their lifetime, they're a little more prepared. But, that's why I say to the men who are having tummy tucks with us, like, prepare for a year of like knowing that you had something done.
Yeah, I think it's a little bit tropey. Like everyone always says, I say it, that men are more sensitive to pain. They're not as strong as women, et cetera. I think it's more that women are just used to things that are annoying to their bodies. And men don't have that because women have cycles and they're used to, since their teenage years, of dealing with stuff. Right.
That's what I mean. We've just had more experiences in our lifetime of,
especially if you've had pregnancies and
inconvenience.
Like that.
Our body being inconvenient.
And that's the stuff that gets men. They're like, oh man, every day. I'm like, yeah, you had surgery.
Well, and swell hell, again, and a lot of this is because women have these, support groups on YouTube or on Facebook for swell hell, and that doesn't exist for men.
We are creating the support group right here.
We are. So I think they're just a little more prepared going in. That's where, this is a great question for men to ask the doctor that they're seeing, like, what will my recovery realistically be like? Like, really tell me realistically what to expect.
Yep.
Yeah.
We had on one of our last episodes, a male patient write in and say his experience in recovery. And he said it wasn't bad. And he did a lot of surgery. And I really appreciate, number one, a man responded, and he responded with saying his recovery wasn't bad, because this is a myth that really gets a lot of men when they come in. They're like, is this really worth it? I don't want to be in a lot of pain, et cetera, et
well,
cetera.
And they also think about the financial downtime and all those other things. Like, so I get it. Like, like I said, they've maybe had experiences with being down and out from an orthopedic surgery for weeks.
Right.
And I get why they're concerned, especially if they're the breadwinner,
Right.
Like those are legitimate concerns. But at the end of the day, this myth is...
Oh, this myth is busted, Amy.
Busted. You're not saying it with the same verb today.
I know. I'm trying to slip it in there, like cool busted,
Sly busted. Well, you got to come from the side if you're going to do that.
Okay.
All right.
My next one will be more vociferous.
Okay. We're going to take a quick break. Everyone can look up vociferous. And
is that the right word?
We'll be back with the rest of the myths. And we're back. And Dr. Martin has used his online dictionary.
Yes. Someone or something.
What's the word?
Vociferous. That is loud, clamorous, and intensely insistent in expressing opinions.
Vociferous.
Pretty much
Yes.
describes what I was talking about.
Oh my gosh. A quick story. I get a word of the day thing from, this online. So last week, I was dying laughing. I came out and told Catherine. So usually I just get one, right? What is the definition of this word? It says it in the body of the heading. The word was superfluous, and they sent the same email 3 times in a row. Never have it was not a glitch. Like, this was on purpose.
Yeah.
I was like, I see you, whatever word thing sends me.
Yeah.
Superfluous. And it was superfluous to send 3
very,
emails.
very good.
Yes.
Very good.
I loved it. All right. Let's get back into our myths. We're back here with number 5. Exercise or more exercise can fix everything. You kind of touched on this with the weight loss issues.
Yeah. So exercise for everyone is essential and probably the most important thing. And no matter what problem you have, exercise will at least be additive. But in most cases, especially with age-related changes or weight loss-related changes, exercise will not solve the problem.
And exercise doesn't stop aging, unfortunately. It's good for longevity, but it doesn't stop it.
And in some cases, or a lot of cases, when you lose weight, especially precipitously, like fast, you actually you look worse. You would think you look better, especially facial and those kind of things. So,
well, and just in general, having skin laxity.
Yeah.
I mean, we see this often even with bodybuilders, who've not lost weight super drastically or like tons of weight or used extreme measures, but they still, when they get super lean, have skin laxity that they don't like. They get thigh lifts, they get tummy tucks, even the men. Like, your trunks can hide those scars.
Who is it? Mike Israetel. He talked about
He had a full body lift.
He had a body lift.
Yeah.
It's so interesting he was completely open about it. He went to one of my guys, one of the people I trained with, Doug Steinbrecher.
Oh.
He was in New York, I think now is in Chicago. He did a full body lift with him. And he talked about the whole experience, and he was graphic. I mean, it wasn't easy recovery.
No, it's not. A body lift is a body lift.
Dr. Mike.
Yeah.
Yeah.
Mike Israetel. Yeah. If, RP Strength is, if you look him up on YouTube, you can find, he documented it pretty well. But yeah, his was not like from him being morbidly obese ever. He's a bodybuilder. So like, even bodybuilders still have loose skin.
Yeah.
Like, it cannot be fixed with exercise.
He was heavier when he was younger. He did lose weight, obviously, when he got really into working out. He had loose skin along his flanks and his lower back. And basically, the only way to fix that was to remove it. I mean, the whole area. And then he also did the front. I think he had like a diastasis or kind of a protuberant belly.
Well, diastasis is actually common amongst bodybuilders, and so are umbilical hernias. Why? Just the abdominal pressure.
Oh, because they just keep pushing it out over and over.
Yeah.
Interesting.
Yeah, a lot of them have that big kind of bump stomach,
Yeah.
It's like, you see that a lot. I've always wondered.
Kind of like you, Nils.
the turtle shell.
No, that's just beer.
Yeah.
That's not from lifting weights.
Yeah. And like there are structural issues that lifestyle can't address. So if somebody does have an umbilical hernia or a diastasis or other things, like those are things, or skin that hangs over your eyes. I mean, those are structural issues that no amount of lifestyle change is going to fix.
Yeah.
As much as we would like it to.
As much as the people at the gym will tell you it's going to fix all these things.
Right. Or that Pilates can fix your diastasis. It just can't. And again, I think this goes somewhat, and I'm not trying to stereotype men in any way, but they think they always, and women do this too. You want to find a way to fix it yourself. Like, can't I just fix this? Or, can't I just do this? Can't I just do this? And sometimes you can, but with excess skin and aging, exercise is not the answer. For
men, if you're talking about masculine body contours, lifting weights can be really, really helpful. Mm-hmm. For example, your upper back and your shoulders, if you can add definition there and thickness there, if you don't already have that, it can make you, from an aesthetic standpoint, look way better. Even if you carry fat down on your hips and stuff like that, it's just making your, shoulders more broad. Women don't usually like that. So there are some areas of your body you can make a lot better as a man. But most of these problems, exercise ultimately won't solve the problem. A good example of that is gynecomastia. People think if they lift weights that they can fill their chest out enough, and you won't, because part of the gynecomastia problem is the breast bud.
Or that you can lift weights to lose that fat, and you can't.
You cannot.
Because it's breast tissue.
It's breast tissue that's somewhat hormonally driven, and especially for people that are really into bodybuilding, sometimes the stuff they're taking can make that hormonal milieu a little bit worse, and then that breast tissue can grow. That's why gynecomastia is more common in those types of people.
Well, and interestingly enough, a lot of bodybuilders get into bodybuilding because they have gynecomastia and they think that working out is the solution.
Right.
And then they just double down on the problem.
When they start taking things.
Yes.
Yeah.
Something interesting though, Dr. Ron, that I know you have seen as you've gotten older is that, yes, exercise can make you look a lot better with your clothes on. But sometimes, it's when you take your clothes off that you see the issues, the loose skin,
the
other things.
Yeah. And I know with me, I lost 40 pounds overall. I definitely have loose skin on my lower abdomen.
Yeah.
Not enough to do like a mini tummy tuck, but probably enough to do treatments and stuff like that. I'm fortunate because of my height that does, even with your clothes off, it's not as visible.
Right.
If I was shorter, I think that would be more of an issue actually. And we see that a lot.
Or if you weren't as in good of shape.
Right. If I didn't have as much muscle mass and stuff like that. By the way, I think about this all the time. And, it's funny. I don't want to be preachy when the men come in our office, because I have a tendency to do that with the men. And I feel bad because, you know what? It's their life, right? I'm not here to preach at them. But the amount of transformation, at least someone like I have seen in my body as a middle-aged man over 10 years is insane. Mm-hmm. And I am super busy. So I'm not the type that can go to the gym for 3 or 4 hours like some of these people do.
That wouldn't help though. Like going to the gym for 3 or 4 hours.
Whatever. Yeah, I'm feeding into the way that men think, right? Also, I'm definitely not the type of person to be taking all these supplements that are probably inappropriate. So I'm not doing all that. By the way, I work a lot. So does Amy. So my nutrition is on point, but it's not like I have a lot of flexibility. It's really hard for me personally to get the nutrition I need to build and do things. But I can do it. Mm-hmm. With the most restrictive kind of schedule that's really stressful, you can do it too. So the idea of cosmetic surgery is really adjunctive to people that are changing their life. If you're struggling and you're going to the gym now, you're really concentrating on your nutrition, it can be really additive to do these cosmetic procedures to the exercise you're doing. Mm-hmm. You can see the results of all this improvement better if you remove loose skin, right?
Or excess fat.
If you have fat in an area that's just hormonally driven. Yep. And by the way, in men, that's the belly and the flanks, basically. Yep. Usually not in the hips.
Yeah.
Not in the bra line or the upper back.
Yeah.
Usually.
Let's bust it.
Busted.
There you go.
Is that better?
That's the busted I was here for.
Was that good, Nels?
All right. Number 4. Myth number 4. It's unsafe.
So I don't know if men are really watching our channel that much, but if you are, you'll see that we go through every single procedure we offer, and they're all safe. And the reason they're safe is because anything elective that you don't need for your medical well-being, if it was unsafe, we wouldn't be able to do it.
It's still surgery.
There are risks with surgery.
Any surgery, not just cosmetic surgery.
And those risks can be serious in some cases. If you go to a board certified plastic surgeon who's well trained and specializes in the procedure that you're interested in, the likelihood of you having a serious problem as an outcome is very, very, very small. And the likelihood of you having a really good outcome that you're going to appreciate and be happy with is very, very high. So, but unsafe is a very strong word, which I would not agree with what I do for a living. Yeah. Would you agree with that?
I would agree.
Okay.
Yeah, our surgeries, like you said, they're elective. We make sure that you are healthy enough for surgery. I mean, if you listen to any of our surgery specific episodes, number one thing if it makes you a candidate for a procedure is, are you healthy enough for surgery? Because if the answer is no, then no.
Yeah, and there's people that do what I do out there that don't really follow an ethical code, and they'll do surgery on people that aren't healthy, and that's completely and utterly inappropriate.
Yeah. But really, if you look at the statistics for plastic surgery, I mean, incredibly safe. Incredibly safe. The anesthesiologist will always say, like, you're way more likely to die in a car accident on your way to the surgery center,
right,
than you are to have even a minor complication. Yeah. And to be fair, we've had all of them. We've had issues. Men have had issues after surgery, just like women have. We've had hematomas. We've had, oh gosh, the patient got gout. I mean, not related to surgery, but maybe just the stress from surgery or whatever.
Probably was. Yeah.
Probably was. Those things have happened. We've had patients who've had to have a Foley or a catheter in for an extended period of time.
Had to go back to the emergency room to get the Foley in. That was miserable for him because he had urinary retention, very common in men, obviously because prostate hypertrophy. So
so
we've had it all.
Happen.
We've had it all. But in terms of quote unquote unsafe, it is not unsafe.
No. Very safe.
But you have to find the right person, the experienced person.
Yeah, don't group on your plastic surgery.
Right. Do your research. Go meet them. Like, look at our episode on
New Beauty Guide, how to choose a surgeon.
How to choose a surgeon. You'll see in there, and please watch it. I mean, there's so many great tidbits in there.
It's an amazing episode.
Yeah. And when you're choosing that surgeon, just FYI, men are usually pretty good at this. Use your kind of gut feeling, what you're feeling inside. If you get a sense like, hey, man, this ain't right. Like, I'm feeling this. They're trying to sell me something. Get out.
Yeah,
Don't
there's
stay.
more doctors. There's another option for sure.
Go to an office like mine. We're successful. We don't have to sell things, right? Hey, we just tell you what we think. And you can choose it or go somewhere else. But we support you, right? No pressure. So
it's safe.
This myth is busted.
Love it. All right, myth number 3.
By the way, James Earl Jones, who was Darth Vader, I just watched a video with him.
He was the voice of Darth Vader.
It took him 2 hours. To do the entire
$6,000, something like that.
He said $3,000.
$3,000 for 2 hours.
No points.
Yeah.
No points on.
Didn't take a credit until Return of the Jedi.
On the third episode, episode 6, I guess. Yeah.
That's right. Crazy, huh?
Crazy.
Although you sound more like Buffalo Bill from Silence of the Lambs.
Listen, Nils.
Busted.
Yes.
All right.
Very, very disturbing comparison.
Yes, especially on an episode about plastic surgery. Myth number 3. It's only about appearance. So that the only reason a man would have this kind of goes back to the vein thing. It's not. There are functional issues that absolutely need to be addressed.
Oh, I mean, eyelids, number 1. That's on your, okay.
Improve field of vision.
I mean, I don't know if I'm dreaming this, but I think this is how it went down. We did surgery on a patient, female, and her husband came in the recovery time. And I looked at him, and maybe she said it first. I feel like I said it first. I'm like, you have to get your eyelids done. I mean,
like, can you see?
How can you see?
Yeah. Like, can you see anything that's happening over here?
To be honest with you, I was worried for like the city of Denver if he's driving around. Maybe you have those like automated driving things where if you try to turn to the other lane, it stops you. But he was terrible, like one of the worst obstructive presentations of dermatochalasis, upper eyelid heaviness. And it wasn't, and for men, it's also the brow. Usually it's the brow and the eyelids. So yeah, he needed both of those. Amy has on here improved breathing for sure with the nose with rhinoplasties. A lot of men and women have difficulty breathing. They can reduce your turbinates. They can fix deviated septums, which primarily is caused from trauma because they did something stupid in sports or they didn't.
Yeah, stuff happens. I've broken my nose a number of times and it wasn't from doing stupid stuff.
What was the last time you broke your nose, and tell us exactly what you did?
So the last time I broke my nose was...
Because I feel like you probably did something stupid.
I did. So the last time I broke my nose, it was on election night. in 2018, and I had fallen asleep in bed with my iPad because I was watching the results, and I woke up.
2016.
It was 16?
Yeah.
Okay. So I woke up and I was looking at the results and I had my iPad here and I fell asleep and it slammed into my face when I fell asleep. And yeah, the next day I'm like, wow, that was bad. Just go back to sleep. Dr. Martin was out of town. And the next morning I woke up and I'm like, oh, I broke my nose. Like,
I
it's
remember
broken.
this. I remember getting this text.
Yeah. Well, so I called you and you're like, I said, do you think I should go to the ER? And he goes, well, you know if it's broken or not. And I said, yeah, I can feel it. It is broken. And he goes, well, just set it now. He's like, do it before the adrenaline wears off. And I'm like, so I put the phone down. I kept him on the phone while I did it. And I sure enough, I went into the office and looked in the mirror and I just pushed it back into place.
Which feels great.
Whew. I mean, it feels away. So yeah, oh man, that was the worst break because that hurt for so long. Like everything hurt.
Did you get the double shiner, the two black eyes?
It was bruised it was bruised for a while.
That's rough.
Yeah. Yep.
Well, I just did a gig with the Colorado Eagles, our minor league hockey game. None of those guys are older than 23, and their noses are all over the place.
All directions.
So they may be clients coming up soon.
Yeah. I could
and it's not just the way
have a whole subspecialty on hockey players and rugby players.
That was honestly Aspen. That was our Aspen.
I know. Better exercise capabilities. What is this referring to, Amy?
Oh, it's just you're able to exercise better when you don't have a lot of loose skin.
Yeah, true.
Yes, like it can be a distraction. I mean, so many of even just getting rid of gynecomastia, like feeling like free to take your shirt off at the gym and not wearing like 3 shirts when you go to the gym. Like if you don't feel good about your body and you're trying to go to the gym, like it inhibits your workouts.
I had that feeling last week. It really wasn't about I just wasn't feeling, vigorous.
Was it because I pulled you away from your leg workout?
No, that was different.
I felt bad about that.
Yeah, well, that's right. But in those situations, I usually put on, I don't know, really strong music and just like try to force myself. And that's really hard to do that. So your mindset when you go, this feeling of empowerment and energy and positivity can make the biggest difference in the gym. And by the way, those feelings could be the biggest difference of a good workout or a really good workout, because you're more likely to push it to that extra rep. You're more likely to focus on your form. You're more likely to just do what you need to do and need to get done. Well,
and you're more likely to go back. If you go to the gym, if going to the gym becomes like a negative experience for you and you feel like you're having to hide or you're throwing on like, the biggest pump cover of all time and you're wearing a hoodie and you're not going to be super excited to keep going in most cases, So yeah, I think to me, that's a big one, like how you feel, how you function.
Yep.
Like these are big things.
I agree.
Yeah.
Busted.
More than just the appearance. All right. Number 2. This is the one that probably most people think, that your scars will be obvious or visible. And in some cases, yes.
Like Mike Israetel's, Dr. Mike's circumferential body lift scars would be visible if he pulled down his shorts.
Right. And were they obvious while they were healing? Yeah, he had drains in for multiple weeks. He was showing them online. So there are times when your scars will be obvious and visible. They will be both. But it's always situational.
Right.
And a lot of times, and I say this to men and women all the time, if someone sees this scar, it's because you've let them. And if they are going to judge you for it, that's a different conversation to be had.
Yeah.
Specifically with things like gynecomastia, because sometimes for gynecomastia, we might have to do a really extended gynecomastia. We do have 2 episodes on gynecomastia. They are old, don't judge us, but Nils will link them because they are really good.
Well, yeah. Okay.
Yeah, they're good. But, sometimes the scars will be visible with your shirt off, perhaps, for a while. But will scars all fade? Absolutely, they will fade. Mm-hmm. And for men and women, this is true. Like once they're healed, they're very hard to perceive in most cases.
Saw one of our patients. She's awesome, mid-70s, super vigorous, awesome patient. She did a brachioplasty of normal weight. She just had loose skin, more fair skin. And she's about a year out. Her scar is still somewhat visible. With her arms out, it's not super visible. Mm. And technically speaking, if you really went up closer, you could see it. But I think her arms are so good now that's a reasonable trade for her.
Absolutely. And with her arms down, do you see it? No. I mean,
Never.
That's what I mean. The scars are situationally visible.
Right.
In some cases, if someone's looking at them.
I guess what I'm saying is like her arms are so good that okay. Yeah, I had a brachioplasty.
Well, it's Mike Israetel with the body lift. Like, dude, he's trying to get a pro card. You know, like he's going to be back on stage. Like he doesn't care. Like to him, the scar was worth the trade-off. And you see scars on people even in, you know, bodybuilding competitions because the scar is worth the trade-off. And if someone cares about your scar, that's on them, not on you.
Right. I do understand people feeling self-aware. Men struggle with this. They don't have a lot of emotional outlets. There's not a lot of community with men talking about how you look. I mean, I can't tell you the last time Nils and I were sitting around talking about how we look besides just making jokes, you know. So it's not like it's endemic in our milieu, and it doesn't matter what your persuasions are as a man or where you come from. It just doesn't really happen a lot. With that said, I do think that if we were a little more open about our concerns, then a lot of times the same rules would apply. Like that's why Dr. Mike is so refreshing. When you hear him talk, I'm not trying to bring him up too much, but like I was really, as a plastic surgeon who operates on men, it was so nice to hear someone talk openly and honestly and was unabashed. It didn't seem like he had any reservations. I mean, that's what he does for a living. He probably increases his viewership.
Well, but interestingly enough, I find that most men aren't really afraid to talk about it. They just don't.
Yeah.
You know, but like, I mean, like I said, all the bodybuilders I know who've had tummy tucks, they openly discuss it. The ones who've had gynecomastia, they openly discuss it.
Yeah.
Like they're not afraid to talk about it when asked. I think people just don't ask.
That's true too.
You know? And like, yeah.
So the last man we did, he was so happy with his surgery. And I told, this is legitimately what I said to him. This was 2 weeks ago. I said, will you do me a favor? If you really are happy with your results, if you ever meet a man who's struggling with the same thing you're having, and you just, you know, it doesn't have to be someone you know, just randomly, just speak up, say something to them. And I was like, they don't have to come to me, but tell them it's a possibility.
Yeah.
Because I think a lot of times men just think there's really no.
Well, because
answer.
they've heard the myth that plastic surgery is only for women. They've
Yeah.
heard one of these other 8 myths leading up till now.
Right.
You know, or they believe those myths. So yeah, you get it.
Let's go.
Myth number 1 brings it all together. But
Hold on,
before that,
Guys, can I bust it?
that's why I said before we go.
Bust it.
Yes. Myth number 1 is the culmination of all of these things together, because this is what all of these things really have underlying them. This
Right.
is the base of the pyramid that all these other myths were built upon. Myth number 1, people will judge me. The vanity, the scars, the healing time, the time off work, all of those things are all things you think
can't believe you care about
other
that.
people are going to judge you
I can't
for.
believe you care about that. That kind of stuff,
Right.
those kind of comments,
Yeah,
you know.
like you
really,
should just deal with it.
you should just deal with it. You're a guy, right?
But see, that's what they think.
Yeah.
Is that really what other people think?
No.
And who cares if they do?
By the way, we know this for a fact because we do this for a living. No one cares. No one's sitting around thinking about you. Now, your loved ones are, but they like you for you.
Yeah, they're not thinking about how you look.
That's why love is so imperative in life. Like if you need to be loved because they love you unconditionally. With they're going to judge you, but the judgment is not harsh, meaning they're going to judge you as loved ones do, but they're still going to accept you. So other people don't care.
And even if they do, who cares? This is your life.
Right. If they do care, I mean,
that's on them.
That's on them. Have a tendency sometimes to be pugnacious. Is that another word?
There you go.
Okay.
Bringing out the big words.
A little bit alpha sometimes, and who cares? Right? Live your life. You deserve this. Do good by other people. Do good deeds. Treat people well. Find a calling in life. Find things that inspire you. Find love. If you have a family, that's the best thing that ever happened to me. Children, that kind of stuff. A significant other. But like, who cares? That's the main thing. Screw them. And if they need help, help them. But like, other than that, like, you don't need to put these people in your life.
Well, and they probably aren't judging you the way they think you.
I don't think they are. That's the main thing. And trust me, I fall into this trap sometimes too. I don't think people really care.
They don't.
I think if I came in dressed as like an Oompa Loompa, they'd be like, that's fine. Are you good at surgery? Like ultimately, I don't think people really care. I think we build this up in our minds, especially as men, because we're so insular. We don't have a lot of outlets to get these feelings out. And so you start to qualify them with weird logic. So in our experience, and we have a lot, people don't really care. By the way, wives or significant others don't really care either. We've experienced that. They're like, yeah, whatever you want to do, man. Sure, I support you. Okay. I mean, They're not coming in saying, I mean, we've had a few wives like that where they're like, he really needs to fix this. But most of the time, yeah, what if
we've had a few unsupportive wives.
Yeah.
But again, that's
just a bad relationship.
Yeah, exactly.
Yeah.
That has nothing to do with surgery.
That's when you start feeling bad. I've been in a situation where I was defending the man who was here to see me with the wife who was there. That was an odd situation.
The woman who was grossed out by her husband's drains and she's like, I'm going to throw up. I'm like, you can go ahead and get out.
Yeah.
Like, you can kindly wait in the lobby. Your unsupportive comments are not helpful here while I'm taking these drains out. Go away. And if you throw up, I'm going to make you clean it up because you're not my patient.
You never would. You're such a mama
somebody's
bear. You would still clean up the throw up. I know you would.
Oh yeah, but I wouldn't be happy about it.
No, you wouldn't be happy about it, but you would still do it because you're that person.
Yeah.
You always do it. You always do that stuff. You've never not, since I've known you since 2008, not been the person who cleans up the throw up even when it was like clearly the problem of the other person that you warned them about. That's a compliment.
How about a surcharge for spouse throw up?
that
you see
would
it
happen.
on the bill, right?
I like that business model.
Right.
Yeah.
Like, I'm going to go ahead and send this bill to you.
Yeah.
No, but people, you know what? And like we both said, here's the thing. If people are going to judge you, they're going to judge you. And like the only person who really matters in this is you.
Yeah.
You're the person who has to live with this. You're the person who has to live with what you don't like every day and being afraid to fix it because of what somebody else might think of you.
Right. And I know hopefully the people that watch this will be young men and middle-aged men and older men, and obviously their significant others and people that care about them. And as a person that's in his mid stage of life, high performer, very motivated, confident, stable relationship, I still have these feelings.
Yeah, because we're all human. We all still have feelings.
Right. And even me who does this for a living, I can talk to Amy, so it's a great stop gauge, but I don't have a big network of people I can go out and say, today I just really didn't like the wrinkles around my eyes. If I said that to my male neighbors, they'd be like, I don't even know what you're saying to me right now. So there is a component of this culturally.
But you know what all those men are going to do?
Yeah,
they'd all go home and look at their own wrinkles that night.
But there is a component of this that culturally speaking, a lot of this stuff is on the hush hush. It's not emphasized, and then men ultimately feel bad about having these feelings. You should not. This is universal. If it gets to the point where in your ear, in your mind, it's starting to affect your life, do something about it.
There is a solution. It's not just for women.
Right.
Nobody's really judging you. Bust it, Dr. Martin.
Busted.
They're busted. Well, I appreciate everybody for being here. If you made it all the way to the end of this episode, you're a rock star and you heard all the myths. If you would like to leave us a comment, you can do that in the comment section below, or you can send me a text or leave me a voicemail at 303-630-9038. Find all of our social media handles linked below. And the next 2 episodes that are coming up, we are doing a deep dive on facial surgery for men. So come back for more.
Loving these episodes.
Yeah.
We should do gynecomastia again.
We need to redo gynecomastia so it's not so old.
Yeah.
Yep. And in the meantime, Dr. Martin, it'll be time for your Shamrock Shake. It is Shamrock Shake time.
Right. This week?
This month.
Oh, yeah.
Mm-hmm. March.
Yeah.
March is the month. March is the Shamrock month.
What all Americans do, a small fry and a Shamrock Shake. No burger. Nothing else, Nils.
Do you dip the fries in the shake?
I tried that one time. It really was not that bad.
Okay. Yeah. It's good with chocolate and stuff. I've never done with mint, though, so I don't know.
It was actually, surprisingly pretty good.
All right. Well, until next time, I'll see you all here next time.
See you later.